Hi guys, Dr. McCoy here at Drummond Chiropractic. Today I'm going to go over some exercises that we recommend for TMD, which is dysfunction within your TMJ. With that, you can have popping, clicking when opening, when eating. You can even feel your jaw shift a little bit, or you just have that ache that kind of starts at the edge of the jaw and goes up the side of the head. If you come into the office, we'll do a little bit deeper of an evaluation where we check to see how far you can open, if there's clicking on one side, if there's muscle imbalances, if there could be some other factors that could be contributing to it. And then treatment wise, we can do muscle work where we kind of release this tension on the inside and outside of the jaw. We give you those little cues and exercises to do at home. Usually work on the upper cervical spine as well because that plays a little bit role in there. And then myself, we can do some dry needling on the TMJ and even the upper neck if that is needed. And what we would give you for kind of homework when you go home is kind of self-massage, self-myofascial work. So the top one is working on the outside of your jaw first, is you feel right where you kind of open and close, feel where that is. You go just in front of that about a half an inch, and you'll be on what's called your masseter muscle. And then you hold a little pressure and then push up, and then open and close, push back, open and close, and then push forward, open and close. And you do that same thing right above where you feel your jaw open, and then a little bit more on your temporal to help relieve all the muscles on the outside of the face, the more superficial muscles when working. The one that would be more on the inside that we recommend either when you're like brushing your teeth or you're in the shower so your hands are cleaner, and you go to the opposite side of your mouth. You go behind your last tooth on your top row of your mouth and you kind of C-shape out, C-shape in to kind of release that muscle a little bit yourself. We do that one a little bit deeper in the office when we're doing it to you, so you know what it should feel like, so then you have a good example. But that is your lateral pterygoid muscle. That's the muscle that closes your jaw. So when you are clenching or you're grinding your teeth, you create all that bite force and pressure goes through that muscle, creating a trigger point in there just like anywhere else in the body. And if that builds up, then that goes up the side of the head, causing pain, discomfort, clicking. The thing that we recommend with TMJ dysfunction is a little thing that helps when you're more conscious of what your triggers are. So it can be stress, it can be something at work, it can be getting ready, it can be exercising like it is for myself. When you find yourself clenching throughout the day, what you want to do is take your tongue, press it to the roof of your mouth. That'll separate your teeth. It's a muscle memory habit is what really causes you to kind of clench your teeth. So your body thinks you have to be able to clench your teeth to be able to doing whatever you're doing. And to kind of break that habit, break that loop, is when you find yourself doing it, you take your tongue, press it to the roof of your mouth, separate your teeth, and then you break that habit, and then you won't do it every time you're doing whatever activity or trigger it is that you're doing. If you have any further questions or you're experiencing these symptoms, just give us a call here at the office.